Hello everyone, I am Pat Andredante from BSN 111F, a student nurse from Davao Doctors College. So for today, I'm going to perform eye assessment return demonstration. So the eyes are the main organs for our visual system. They give us the ability of vision or the ability to perceive life. So it is really important to have our eyes corrected to improve the quality of our everyday life. So prior to the conduct of the procedure, the first thing that we need to do is to review the client's medical record, and this is done to identify instances of harm to patients' medical histories and treatment procedures. Okay, so next is we're going to determine the scope of assessment and prepare necessary equipments prior to meeting the client to conserve time and energy. And for this procedure, we need a gloves to prevent cross-contamination since we might be touching some part of the patient's face, pen and paper for documentation, Snellen's chart for which will be read by the patient in testing for visual acuity, an opaque card, which will be used to cover the one eye while observing the uncovered eye, a Q-tip to inspect the palpebral conjunctiva, and of course, a pen light, which will be used in testing for light perception. Next is I'm going to perform hand washing to protect my patient and myself from infection and cross-contamination, which I did earlier. But now, I'm just going to perform hand hygiene to deter the spread of the microorganism. Okay? And of course, to create a barrier between germs in our hands, we'll be wearing a gloves. Okay, so we'll now meet our client. So now let's proceed to the introductory phase of the procedure. So the first thing to do is we need to greet the client politely and the client's companion if around. And we need to introduce ourselves to the client and verify the client's identity using the two identifiers, which is the client's name and birthday. Also, we need to ask the client how he would like to be called during the assessment, and most importantly, we need to establish rapport to our client. Verifying the client's identity help us to know if we have the correct client, and establishing rapport with the client makes them feel comfortable and less anxious. Also, we need to explain the procedure to the client and how she can participate during the assessment. I will then provide the client the opportunity to clarify, ask, or raise any concern. This is done to elicit cooperation from the client, and providing the opportunity to ask help for us to know if there is more information that our client would like to know more about. Next is we're going to ensure the client's comfort, privacy, and confidentiality. Also, the assessment setting is assured to be safe, secured, and free from distractions. And make sure to position the client to a comfortable and seating position. This is done in order to provide comfort to the client during the assessment and also provide dignity and have an entrusting relationship with the client. Hello ma'am, good morning. I am Pat Andredante, your student nurse for today. How are you ma'am?
I'm good.
Okay ma'am, so may I have your wristband please? Okay ma'am, please state your complete name.
Leslie Christine Obupat.
Okay, your birth date.
December 26, 2010.
Okay, thank you. So ma'am, how would you like me to call you during this assessment?
Leslie.
Okay ma'am Leslie, thank you. So ma'am, the procedure we're going to do is called the assessment of the eye. So this is a procedure that I'm going to check your eyes to see if you can see clearly in the distance, in the dark, and in the light, and if there are any angles that you can see or not. So we have this position, ma'am, that where you sit and you stand. Then I will have you read from a distance, and there will be a light that will be shown close to you. Is that okay with you, ma'am?
Yes.
Okay, if you have any concerns or clarifications, ma'am, feel free to ask me, ma'am, okay?
Okay.
So ma'am, I'm just going to close the door and draw the curtains to provide privacy. Would that be all right?
Yes.
Okay. Okay, ma'am. So is the temperature good for you, ma'am?
Yes.
Okay, are you comfortable with your position?
Yes.
Okay, ma'am, don't worry, ma'am, because all the results and information that will be gathered is secure and will remain confidential, meaning only the two of us and also your attending physician who are taking care of you will know. Okay, ma'am?
Okay.
So do you have any questions?
No.
Okay. So now let's proceed in the working phase. So prior to assessing the visual acuity of the patient, we must first check and ask the patient if she has visual fields. Okay, ma'am, so let's start with assessment. But first, I would like to ask you if you use any contact lenses or graded lenses.
No.
Okay, so do you have any problems with your vision, ma'am?
No.
Okay, do you have eye floaters or spots in front of your eyes?
No.
Okay, so do you have any prior illnesses, especially with your eyes?
No.
Okay, ma'am, that's good. So how many hours is your screen time, ma'am?
8 hours.
Okay, ma'am, so do you have any family member that having illnesses with regard to the eyesight?
No.
Okay, so do you do any physical activities, ma'am?
Yes.
Okay, thank you, ma'am, for this information. Now that we're done with the history taking, ma'am, we'll now proceed to the test. So are you ready, ma'am?
Yes.
Okay. So now let's proceed on assessing the visual acuity of the patient. Okay, so now I'm going to let my patient stand 20 feet or 6 meter from the Snellen chart or E chart, then cover the eye being tested and I ask her to read each line until they cannot decipher the letters or their direction. I'll take the 3 readings, first by reading using the right eye, then the left eye, and after by reading using both of her eyes. This will allow me to compare the results of each eye and provide a more comprehensive assessment of visual acuity, and then record the readings of each eye and both eyes. This includes the smallest line from which person is able to read one half or more of the letters, because recording the readings is important for proper diagnosis and treatment. Okay, ma'am, so can you please stand up? Okay. Facing the Snellen chart, please. Okay, so what I need to do, ma'am, is to use this opaque card right here. Opaque card. Cover your right eye like this. Okay? And then try to read the letters, ma'am, that are written in the Snellen's chart, just up until the letter you cannot still see, okay?
Okay.
And after doing the right eye covered, ma'am, proceed now to the left eye, ma'am. And after the left eye, read the Snellen chart, both of your eyes, okay? Is my instruction clear, ma'am?
Yes.
Okay, so you can proceed now, ma'am, by covering your right eye. Okay, ma'am, start.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O P E C L E P O T P C T.
Okay, ma'am, proceed now to your left eye, covered. Okay, start.
E F P T O Z L P E D P E C F D E D F C Z T F E L O P Z D D E F P O T E C L E F O D P C T.
Okay, now, ma'am, read it with both of your eyes.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E C L E F O D P C T P D P L P C E O.
Okay, ma'am, thank you. So you can sit back now. Thank you. And we can also perform selective vision test, light perception, hand movements, then counting fingers if necessary. If the client is unable to see even the top line, which is the letter E, 20/200 of the Snellen type chart. Okay, ma'am, so tell me how many fingers I am raising, okay?
1,
Okay, good.
2,
Okay.
4.
Okay, so now tell me what direction I am pointing at, okay?
Side, side, up, down.
Okay, so now I need you to tell me if you could see the light, okay? So, can you see it?
Yes,
Where is the light coming from, ma'am?
up,
Okay.
yes,
Where?
down.
How about here?
Yes,
Where?
center.
Okay. Okay, now let's proceed in assessing the visual fields of the patient. So now, ma'am, we'll be assessing your visual field to assess the function of your retina and your neural visual pathways to the brain and optic cranial nerve. Okay, so now we have to face the patient directly at a distance of 60 to 90 centimeter or 2 to 3 feet. And instruct the client to cover the right eye with a card and look directly at their nose to assess your central visual field. Okay, ma'am, so please cover your right eye with this opaque card. Okay, and then I'm covering mine too. And look directly at my nose, ma'am. Okay. Okay, ma'am, tell me if you see my fingers.
Yes.
Tell me if they disappear.
No.
Tell me if you can see my fingers.
Yes.
Tell me if they disappear.
No.
Tell me if you can see my fingers.
Yes.
Tell me if they disappear.
No.
Okay, that's good. So now for the peripheral visual field, we have to cover or close the eyes directly opposite the client's covered eye and look directly at the client's nose. Temporarily, peripheral objects can be seen at right angle, 90 degrees to the central point of vision. I will then hold a pen light with fingers, extending my arm, and move the object into the visual field from various points in the periphery. Note that the object should be an equal distance from the client and me. And ask the client to report when the moving object is first spotted to test the temporal, upward, downward, and nasal field of each eye. Make sure to observe delay responses in the peripheral vision. Repeated the above steps for other eye, reversing the process. Alright, ma'am. Now what we're going to do is to cover your right eye first with this fake card. Cover your right eye, ma'am. And stare directly at my eye, ma'am. And once you can see my hands move, you can address it by saying stop, okay? Okay?
Stop.
Okay?
Stop.
Okay?
Stop.
Okay?
Stop.
Okay. So now, ma'am, let's proceed with a visual inspection of your eye and their internal structures, ma'am. So you just have to look directly at me, ma'am, so that I can observe your eyes, ma'am. Okay? Okay, ma'am, so as I can see, your eyes are both symmetrical, ma'am, and that's good. So now I'm going to inspect the eyebrow for hair distribution, alignment, and skin quality and movement. Now I'm going to ask the client to raise and lower the eyebrow. Also, we have to inspect the lashes for evenness of distribution and direction of the curl. Okay, ma'am, so can you raise your eyebrows, ma'am? Okay, now lower it down. Okay, thank you. As I observe, ma'am, as well as there is an equal movement, eyebrows are evenly distributed, the skin is intact, and eyebrows are also symmetrically aligned, and your lashes are slightly curled outward, which is a normal indicator. Okay, so now let's proceed on the visual inspection of the eyes of the patient. Okay, now ma'am, we'll proceed with the visual inspection of your eyes and their internal structures. So you just have to look directly at me, ma'am, so that I can observe your eyes, ma'am. Okay, as I can see, ma'am, your eyes are both symmetrically aligned, and it's normal. So now I'm going to inspect the eyebrows for hair distribution, alignment, skin quality, and movement. And I'm going to ask the client to raise and lower the eyebrow. Also, we have to inspect the eyelashes for evenness of distribution and direction of the curl. Okay, ma'am. So, ma'am, can you please raise your eyebrows for me? Okay, lower it down. Okay. As I have observed, ma'am, as well as there is an equal movement, eyebrows are evenly distributed and skin is intact. And eyebrows are also symmetrically aligned, and your lashes are slightly curled, which is normal indicator, ma'am. Okay. So now I'm going to inspect the eyelids for surface characteristic, position in relation to the cornea, ability to blink, and frequency of blinking, and inspected the lower eyelids while the client's eyes are closed. Okay, ma'am. Now, ma'am, can you close your eyes and blink? Alright. So your lids, ma'am, are closed symmetrically, the skin is intact, and I did not observe any discoloration or discharge, which is great. Now I'll be inspecting the area over the lacrimal gland, ma'am, and your lacrimal sac for swelling. Okay, just keep your eyes closed, ma'am. And is it alright if I could touch your eye area?
Yes.
Okay, thank you. I'm just palpating, ma'am. If there is no swelling, edema, or tearing present. Okay, so you can open up your eyes, ma'am. So as I have observed, ma'am, there is no edema or swelling that occurred in your eyes, and that's good. Next, ma'am, I want you to look up, and I will be depressing your lower lid to assess sclera and bulbar conjunctivae. Alright, ma'am, I'll inspect for your palpebral conjunctiva by everting your eyelid with the use of cotton buds. This is done to evaluate the color, texture, and presence of any discharge. Okay? I'll be touching your eyes, ma'am, okay? Okay. Okay. So upon checking, ma'am, your sclera appears white and there is no swelling on your conjunctiva, which is a normal indicator. Okay, ma'am, this time, look straight to my eyes again as I'll be inspecting for your iris, pupil, cornea, and lens for clarity and texture of your eye. I'll be shining a pen light, ma'am, on your eyes to assess those. Is that alright for you?
Yes.
Okay. So I'll be shining it, ma'am, okay? Just look straight ahead. Okay. Okay, thank you, ma'am. So as I can see, ma'am, that your cornea is shiny and smooth, the iris is visible, and the pupil is black in color, and the size of the pupils are symmetrical with each other, and that's normal indicator. So now let's now proceed on assessing direct and consensual pupillary interaction to light. So ma'am, for the next assessment, I'll be inspecting for direct response, which is the ability of your pupil to change in size, and consensual pupillary reaction, or the construction of your eyes, by still using my pen light, ma'am. So this test, ma'am, will help us to determine the function of the third or oculomotor and fourth trochlear cranial nerve. So from about 2 feet directly in front of the patient, shine a light into the patient's eyes and ask the patient to look at it, and shine a light obliquely into each pupil in turn, using a pen light approaching from the side. Look for direct consensual reactions. Okay. So ma'am, I'm going now to shine a light on your eyes. Would that be okay?
Yes.
Okay. Look directly at the light, ma'am. Okay. Okay. The other side. Okay. Okay. So ma'am, as I can see, the illuminated pupils and the non-illuminated pupils are constricted, and also the response is brisk or fast. Okay, so now I'm going to assess the patient's pupils' reaction to accommodation. Okay, ma'am. Now I'll be assessing for the accommodation of the eye, or the refractive power, when something is close to you. So now we have to hold the object, a pen light or pencil, about 10 centimeter or 4 inches from the bridge of the client's nose. Okay, ma'am. So what you have to do, ma'am, is to look at the first tip of the pen light here, and after that you have to alternate your gaze from the near to the far object. Okay. Okay, ma'am. Focus here in the pen light and look at backwards. Okay. Focus again and look. Okay. So now just focus on the tip of the pen light while I move it towards your nose. Okay, ma'am. Focus. Okay. So ma'am, as based on my observation, when the object is near, your pupils are constricted, and when you look at farther, your pupils are dilated. So pupils converge, ma'am, accordingly, and overall, your pupils are equally round and react to light and accommodation, or PERLA. Okay, so for the next assessment, we'll be performing the Hirschberg test, which is also known as the corneal light reflex, which means that we'll still be using this pen light. This test is used since it is a quick and easy way to check for the ocular alignment of the eyes. So from about 2 feet directly in front of the patient, shine a light into the patient's eyes and ask the patient to look at it. So inspect the reflection in the corneas and look for direct and consensual reactions. Okay? Okay, ma'am. So now I want you to look straight ahead while I shine my pen light. Alright? Okay? So I'll shine it, ma'am. Okay? Okay, so the reflection of light appeared to be in the same position for both of your eyes. Therefore, ma'am, you have normal alignment and normal corneal light reflex. So now, after that, we're going to assess for extraocular movements, looking for a normal conjugate movement of the eyes in each direction or any deviation from normal, nystagmus, lid lag, and convergence. Okay, ma'am, so for next test is the cardinal fields of gaze test, or the test for your extraocular muscle. So this test, ma'am, includes the assessment of your 6 ocular movements to determine eye alignment and coordination. Okay, so now I'm going to stand 2 to 3 feet of the patient and ask the patient to follow your finger or the pen light while making a wide H in the air. So look for jerky movements or off nystagmus on lateral gaze and on upward gaze. Watch for the rim of the sclera between the upper and iris as the eyes move up and down. Okay? So ma'am, so what I want you to do is to just focus on the tip of the pen. Okay, so without popping your head, or only follow the pen light, ma'am, okay? Okay, follow, ma'am. Okay, so ma'am, as I can see, both of your eyes are coordinated and move in unison with the parallel alignment. Okay, now let's proceed on testing for convergence. Okay, ma'am, now that we're almost done, our last assessment, we are going to do a convergence test, which means that I will measure distance from your eyes to where both eyes can focus without double vision. So, ask the patient to look at my finger as I move it towards the bridge of the nose and check eye convergence. Note that the normal near point of convergence, or NPC, is about 6 to 10 centimeters, and convergence recovery point is 15 centimeters. Okay, ma'am? So now I want you to focus just on my finger and just follow as I move it, okay? Okay. Okay, thank you, ma'am. So now let's proceed in a summary and closing phase. Okay, ma'am, so now that we're done with the assessment, I'll just do a recap on the information that I have obtained during the assessment. Okay, so ma'am, earlier, you passed all the tests for your left, right, and both eyes for visual acuity with a score of 20 out of 20. So you can perceive peripheral object at standard angles for your visual field. Your brows, ma'am, are symmetrical and evenly spaced relatively to the features of the eye. So your skin is unblemished, your lashes are slightly curled outward, the sclera is white, and there is no conjunctival edema. So your immediate and voluntary pupillary response is met with a prompt response and typical accommodation, and normal eye alignment occurs. For the extraocular muscle test, it reveals adequate parallel alignment and eye coordination. It is visual for your near point of convergence to be around 8 cm and for your convergence recovery point to be 15 cm. Overall, ma'am, according to your eye test, everything is normal. However, ma'am, I would like to advise you to limit your exposure to your phone screen in order to preserve your vision, a good vision, as continuous blue light output might destroy your retina and impair your vision. Okay, additionally, ma'am, take food high in vitamin E, such as leafy green vegetables, are strongly advised. And a good sleep schedule should always come first to prevent damage to your optic nerve. Is that clear to you, ma'am?
Yes.
Okay, so do you have any concerns or clarifications, ma'am, before we end?
No.
Alright, ma'am, so that ends our assessment for today. And an attending physician, which is our ophthalmologist, will see you shortly and prescribe wearing glasses or contact lenses if necessary. So thank you so much for your cooperation, ma'am, and have a great day. Okay, so now that we're done with the assessment, we can now document any additional information on the patient's record. Okay? Okay, so after this, we can now perform hand hygiene. Okay? So that ends our eye and visual acuity assessment. Thank you so much.